Ladies and gentlemen, welcome to CHCI's second day of the 2020 Leadership Conference. We're very excited to have you join us for this panel session titled Mental Health, Starting a Journey of Recovery. My name is Winta Menges, and I'm the Senior Director of Corporate and Foundation Relations at CHCI. As the lead CHCI staffer leading our health and healthcare convenings, I am thrilled to bring this topic of tremendous significance at the forefront of our agenda as more Latinos continue to suffer in silence and have their mental health needs unmet. Now, prior to introducing our panel host, I would like to thank, on behalf of CHCI, the Better Medicare Alliance, and Anthem for their generous sponsorship of this session. Before we begin our panel, it is my honor to introduce our panel host, Congresswoman Grace Napolitano, who represents the 32nd Congressional District of California. Now, many of you may know Congresswoman Napolitano for her groundbreaking work on mental health. As the founder and co-chair of the Congressional Mental Health Caucus, she was very active in securing mental health parity in the Affordable Care Act. You may also know that she dedicates tremendous energy to promoting mental health legislation and working with key stakeholders to increase funding and access to mental health services. Now, this panel of experts will discuss mental health concerns, awareness, stigma, and ways to overcome them. I personally believe that mental health is one of the most neglected and yet essential issues in advancing our overall health and well-being. Now, recognizing and acting on mental distress, especially in these uncertain and turbulent times, is key to lessening the impact. To help us moderate this important and timely discussion, we are delighted to have Chiara Alfonseca from the HuffPost. Chiara has written for NBC News Digital, ProPublica, and Rochester City newspaper. Additionally, she's a member of the National Association of Hispanic Journalists, Investigative Reporters and Editors, and the Society of Professional Journalists. Welcome, and I hope you enjoy this session. And please remember to continue the conversation on social media with the hashtag CHCIHHM20. But before we hear from Congresswoman Napolitano, we will hear brief remarks from our sponsor of this panel.
I'm Congresswoman Allison Schwartz, President and CEO of the Better Medicare Alliance, and I'm pleased to be with you today. Better Medicare Alliance is a community of nearly 150 healthcare organizations and 500,000 grassroots benefit advocates, all working together to grow and strengthen Medicare Advantage, the public-private partnership in Medicare that ensures the lives of more than 24 million Americans today, 40% of all Medicare beneficiaries. We work together with our ally organizations, including the National Hispanic Medical Association and the National Hispanic Council on Aging, to close the gap on racial disparities in healthcare, use the power of telehealth to reach underserved communities and improve health equity, and protect the quality, affordable coverage found in Medicare Advantage, which leads to lower consumer costs and seeks innovative solutions to enhance care and benefits for millions of older adults. Today's roundtable on mental health is both important and timely. COVID-19 brought health disparities and the reality of loneliness, social isolation, depression, behavioral health, and mental illness into a brighter light. As the entire healthcare system in the country experienced dramatic stress, we saw Medicare Advantage respond quickly to the public health emergency. Health plans, providers, community partners transitioned to telehealth to be sure that seniors living alone were not isolated, offering meal delivery and reaching out with home visits, video and audio calls with clinicians, and even check-in calls to ensure patients stayed connected to the care they needed. Research we commissioned showed that Medicare Advantage's rapid uptake of telehealth during this pandemic helped beneficiaries connect with behavioral health providers, and we saw patients respond with reduced no-show rates for this essential care. COVID-19 presents mental health challenges for nearly every one of us. For those facing the challenges of mental illness, it is even more so. We at BMA share your concern and look forward to today's discussion to bring attention to how this issue impacts the Hispanic community. We look forward to continuing to work together to ensure quality of accessible care for all Medicare beneficiaries. Best wishes on this roundtable and the conference.
Hello, I'm Congresswoman Grace Napolitano, Thank you to CHCI for putting this program together. I'm very proud to represent California's 32nd District and co-chair the Congressional Mental Health Caucus with my Republican colleague, John Katko of New York. We are 110 members strong. The caucus works to educate members and staff on the work needed to expand access and protections, reduce stigma, and promote bipartisan legislation. Mental health in Congress is building momentum, yet still affects millions in the Hispanic community and remains underfunded and misunderstood. Prior to this virus, only 1 in 20 individuals from the Hispanic community received services from a specialist. This is largely due to the long-standing stigma and health disparities, the fear of deportation and language barriers, and other factors. Pandemic is worsening an already existing mental health crisis with fear, anxiety, are overwhelming and causing strong emotions. While schools work to navigate this pandemic, it's important that we provide them with the resources to create a mental health plan to reach their students during this stressful time. If we address stigma and services early, we can help students and families of color succeed. I know this firsthand from my years of direct local involvement. After learning 1 in 3 Latina adolescents had contemplated suicide, I secured $500,000 in federal seed money in 2001. We partnered with Pacific Clinics in Los Angeles County. We started a successful youth suicide prevention program with that money. Schools were resistant at first because of the stigma. However, the program, which began in 1 high school and 3 middle schools, has since grown to 35 schools. Thanks to the Los Angeles County for now funding the program. And it serves as a model for HR 1109, the Mental Health Services for Students Act, which would provide $200 million for 100 school-based programs nationwide. To further identify gaps in access and address stigma, I introduced HR 4543, the Reducing Mental Health Stigma in the Hispanic Community Act, which directs SAMHSA to develop and implement an outreach and education strategy to promote mental health among Hispanic and Latino populations. Legislation reinforces this message. There is absolutely zero shame in asking for help. We need to address horrible conditions I've seen in the CBP facilities at the border. All of us have been horrified by the cruel separation of families and overcrowded detention facilities. Less visible is the internal suffering of these individuals. Many asylum seekers have endured trauma, both in their home country and on their long journey, only to be further traumatized at the border. I have introduced HR 6075, the Immigrants Mental Health Act, which would develop a training curriculum for CBP agents to identify mental health signs in immigrants. Our work continues, but it cannot and must not be limited to our Congress. Encourage all of you, get involved, continue to educate your elected officials on these important issues, and share your knowledge with friends and family. If you see someone who has fallen on hard times, help them out and refer them to mental health services. Together we can strengthen the mental health well-being of our Hispanic community and all minority communities, and eventually live in a world where there is no stigma. Lastly, during this pandemic, please wear your mask. Keep 6 feet between yourself and others. Wash your hands often. Stay safe. God bless.
Good morning, everyone. My name is Kiara Alfonseca. I'm a producer and journalist on HuffPost. And I'm so excited to chat with some great mental health care professionals who can help us better understand how the current mental health crisis in America is affecting the Latino and Latinx community and what we all, as individuals, policymakers, and journalists, can do about it. And this conversation is particularly important now when the coronavirus pandemic is disproportionately impacting this community financially, physically, and mentally. So remember, there will be a chance to ask questions after our discussion. So throw in your questions via the Q&A feature on your screen and choose room C and submit any comments in the chat. And if you're posting on social media about this, be sure to use the hashtag CHCIHHM20. It's a mouthful, but it's hashtag CHCIHHM20. So let's hop right into this. Let's have our panelists introduce themselves and the organization and the work that they do. So let's start with Frederick Santiago.
Good morning, Kiara. Thank you very much for the opportunity to introduce myself. My name is Frederick Santiago. I'm the Executive Director for the National Latino Behavioral Health Association. I've been with the association since the year 2000, started as a member of the board of directors, became the board president, and then became the executive director of the agency. I have actually had the opportunity to work in the behavioral health field for more than 35 years, and in that time, I've also been served as a governor appointee, as the deputy secretary for the Department of Health, income support division director, and mental health director for the state of New Mexico during that 38 years of service. I am very proud to say that the National Latino Behavioral Health Association has its roots in the Latino Mental Health Congress of the year 2000. Is to reduce the great disparities in funding, research, lack of culturally appropriate, and the shortage of workforce clinicians of the bilingual background of Latinos. We currently manage two national Hispanic and Latino addictions and prevention technology transfer centers, as well as operate a behavioral health interpreter training program. And we're intimately familiar with the needs of the community across the country, the significant disparities, but more importantly, the opportunity for us. And I look forward to sharing more about that during the course of this session. Thank you.
Awesome, thank you. And we'll move over to Laura Herrera.
Hi, good afternoon, everyone, and thank you for having me. I am the Vice President of Medicaid Clinical Operations for Anthem, and in that role, we oversee 24 markets or almost 8 million lives where we provide healthcare insurance. And Anthem has been an active partner in all our states in making sure that behavioral health needs are met, including among the Latino community. So I'm really excited to be here and share more about what we're working on and how we're helping to address this very important.
Awesome, thank you so much. And then we're going to move to Serena Davila.
Hi, good afternoon, everybody. My name is Serena Davila, and I am Senior Director at Federal and Congressional Affairs at the American Psychological Association, also known as APA, which is the leading scientific and professional organization representing psychology with over 121,000 members. My portfolio includes teaching, minority issues, and immigration. And I've worked here for almost 5 years. And my educational background includes a law degree. And I have experience working on Capitol Hill for Senators Feingold and Bingham. And also, I've previously worked at the Hispanic Association of Colleges and Universities. I look forward to our conversation here today.
Thank you guys for joining us. So excited to have this conversation. So, we're going through what some might consider a collectively traumatic experience, right? And the Latinx community is one of the hardest hit by the pandemic. And everything going on can have a lasting effects on us as a community. So what are some signs that we should be looking out for amongst ourselves and our families and our peers that could signal a need for help? So we'll start with Laura. Your thoughts?
Sure. So I think a lot of people think of, having a low mood or feeling depressed. But oftentimes, these symptoms can manifest themselves as problems sleeping, irritability, or having physical complaints such as headaches that they weren't having before, or having more upset stomachs than they normally would. People talk about feeling nervous or los nervios, just feeling anxious about what's going on. In addition, they can have poor interest and not engaging in things that used to make them happy, or like I said, changes in their sleep, changes in their appetite. Those are just some of the symptoms or the physical presence of how it might feel to the person who's undergoing changes and how they're feeling about everything that's.
Of course, thank you for that. Serena, do you have any other signs that we could be looking out for?
Yeah, I agree with all those symptoms. So I'm just going to turn my volume down. I'm hearing an echo. There we go. So yeah, all those symptoms are exactly right. Difficulty sleeping, loss of appetite, loss of activities also that people normally enjoy. For children, a lot of the times we'll see sort of a disengagement in school, or for parenting also sort of a disengagement in social activities. So, we look for signs like that, and we would often say if you suspect someone may need help, it's important to talk to them and offer your support, and obviously in a non-judgmental way.
Right. So now that we know some of the signs to be looking out for, there are so many boundaries to addressing these and getting help, right? Lack of access to healthcare, language barriers, cultural stigma. There's something broken about our system that folks aren't getting help, right? So let's talk about policy and public services. And I'll start with Fred first. What's working and what isn't? How do we solve these kinds of problems? So, Fred, your thoughts?
Yeah, thank you, Kara. This is a really critical question because I particularly like it because it places focus on the system of care rather than the persons. Because in large measure, the crises that we're talking about are very significant. And I just want to point out that it's so uncommon to actually have four health crises all at the same time. So when we think about the mental health crisis currently across the country, which has been really based on its historical creation because of the differences and disparities in funding mental health versus healthcare starting back in the 60s. The opioid crisis of today is very significant, it continues to persist. And lastly, we also know that both COVID and racism, as public health crises, all are now intersecting at a time that are significantly impacting the health and welfare of Latinos. And we're all very familiar with the disparities that continue to persist, right? We know that there's a continues in the limit of access to treatment services, and I'll share some data a little bit later at the closing. We also know that the overall health status of Latinos continues to worsen, so that's yet another significant indicator. We, of course, see the limited language access to services across the nation. That is very significant given the large percentage of Latinos who still speak their native tongue. And then, of course, there's the perennial shortage of behavioral health practitioners. But I want to certainly say that we want to give credit where credit is due. There have been some improvements, certainly in the last 20 years, and it's significant to remind folks of those successes because in all of it, there is hope that things do get better, and that's really my message. We're very fortunate that the Affordable Care Act continues to provide the type of coverage for essential benefits, including behavioral health services. That's really significant. Latinos have actually have been very significantly uh, engaged in making sure that they complete their academic studies. So we are actually narrowing the scholastic achievement gap. There's a lot to be said about that, and that's something we should be very proud of. We also have seen at the continued health workers across the country, across particularly those states who are promoting the use of community health workers and promotoras. And I would simply say there has been most recently an increase in training for the behavioral health workforce across the nation through the technology transfer centers. So I'll just end with this. What's still needed? My God, that list is pretty long, but I'll keep it very brief here. There's a need to continue to ensure that we have a fully integrated healthcare delivery system in the United States. We also need to double the behavioral health workforce in the United States. It's really critical that we fully implement and enforce parity laws. That has been an issue for a number of years now. We also know that there's a lack of implementation and enforcement of the class standards. And I'll end with this. We also recognize that the opportunities that telebehavioral health has created is important because it helps to protect the privacy and confidentiality of families by being able to receive services from their homes. We also see, of course, there's a significant need to ensure additional funding for research by Latino serving organizations and Latino researchers. So that's kind of in a nutshell the most significant aspects of the system that really are present today that in some ways are very reflective of what things were like 20 years ago. But there have been some significant improvements, and I think that's very important to say. Thanks.
Yeah, thank you. I guess we can stick with the positivity. Laura, what's working right now that should be an example for healthcare providers and policymakers to follow?
So, as was just mentioned, certainly, being able to switch to telehealth services. So, given the pandemic, the healthcare delivery system was quickly able to change to meet the needs of members, especially members with, with behavioral health needs. And so, the ability to provide care via phone or a computer. Now, there's still some bandwidth issues and internet access issues that are the Latino community, challenge is accessing, but certainly the ability to deliver healthcare outside a traditional facility has enabled a higher level of engagement, opportunity to engage. I think, as was mentioned earlier as well, certainly more and more education that's happening around school, and even though kids aren't in school today, but certainly as a place for teachers, guidance counselors, and others in the school to be able to access when someone is struggling, and then to be able to connect them to services. So I think lots of different areas are stepping up and trying to not only reduce the stigma, but help create the access. But behavioral health providers in general are lacking those that speak Spanish and can meet the needs of our monolingual Spanish residents, and it is difficult. The American Psychological Association did a study. It's old, from 2015, but back then, less than 6% of all psychologists were able to deliver their care in Spanish. And so we need to do more to engage young Latino students into the sciences and encourage them to, pursue being clinicians, so that more and more of the workforce is able to provide care in Spanish.
Thank you, and I'll pass this on to Serena as well to hear what you have to say. But how do we address some of these barriers that I mentioned earlier?
Sure, absolutely. So, as has been mentioned, certainly this pandemic has brought out a lot of disparities, if you will, especially for the Latino community, and access to proper health care. And as Laura mentioned, telehealth has certainly been a big improvement, and it's helped a lot of people that we've seen in these circumstances. And APA has been working a lot, my colleagues, on the telehealth measures in Congress. But it's also brought out, sort of the other side of it, which is that, as my colleagues are underscoring, just the need for bilingual healthcare practitioners. A lot of mental health professionals are not familiar with the diversity of Latino culture, and obviously the insufficient numbers of professionals who are fluent in Spanish and other languages. Another point is, as was brought out in the introduction, was just the element of stigma that can be a barrier to individuals accessing care. So that's something that we try to work on as well within our organizations and our profession. And another aspect that I wanted to mention was just strengthening the pipeline, right, for minority healthcare professionals. So, for example, it's important to support psychologists who understand the Hispanic culture and healthcare professionals who speak Spanish. APA receives federal funding for a program called the Minority Fellowship Program. We work with a lot of other behavioral organizations to receive this funding, and to really improve that pipeline of young professionals that are coming up in the field, while at the same time emphasizing the current, the importance of individuals now in the system that are providers that can work with the population. And what can we do to help the situation? We can certainly remind members of Congress and local leaders to support those who are most in need and have lack of resources to these medical needs. But we have made a lot of progress. I think we have several members who are joining us in this conference in Congress that are Hispanic, but also members that are not need to be aware of Latino and Hispanic.
Yeah, so the cultural stigma is something that keeps being brought up, and it's really hard to ignore, right? There's stigma around mental health and mental illness. How do we break this down? Where do we start these kinds of conversations in our home and even in policy? So I'll throw it back to Fred and hear what you have to say.
Thanks, Cara. Yeah, stigma is such a significant barrier. So if you think about its origins, stigma is rooted in the issue of discrimination. So you start to think about what would prevent someone from getting help. If stigma itself has been the most significant way of discouraging people from seeking help, and it's been in place for so long, we clearly have our work cut out for us. But the good thing is that we are starting to increasingly recognize as a nation the significance of how stigma has deterred people from getting the help that they so rightly deserve. And because of that, there's several organizations across the country, including those that are here present today and many who are attending today's session, who have been at the forefront of trying to reduce stigma. And there are several approaches that have been used to help to begin to diminish the impact that stigma has. Having the opportunities for people with those lived experiences to express their stories and be able to explain to others, family members, professionals, and the community at large as to what this experience is like. Keeping in mind that the data tells us that all of us in our lifetime will start to experience that has something to do with mental health. And ability to express our human compassion towards others has to be continuously cultivated, expanded, so that we can have additional educational and informational opportunities to share this. And Latinos, we're unique in a number of ways, right? How do we look at this issue? Well, we also very quickly recognize that stigma in the United States is actually widely present, and so it deters us from seeking help. But we also recognize that there is a double stigma within our own community, where we have come up with terminology and phrases that describe a person with a mental illness. I have a sister who suffers from schizophrenia. I watched, observed, and witnessed how folks in our communities and across the nation have continuously used stigmatizing terms to really, really impact the person's well-being. So it's really rooted in my belief, and I'll end with this, is that stigma really needs to be addressed even beyond what we've been able to do to this point, so that there is a national platform, a national agenda, a national effort to really ensure that we start with looking at ourselves, how we speak to that in our families, and how do we address that in our, because us doing it collectively will help diminish the impact of stigma.
Thank you for that. Yeah, I appreciate that. Laura, do you have any comments around stigma and how to break that down, like Fred was talking about?
Yeah, I would just echo several of the comments that Fred said. We have to stop labeling it, right? And there's lots of different labels for someone with a behavioral health condition. And, at least in the Latino community, growing up hearing about people being crazy. And so we really need to remove those labels and start treating it as any other condition that we would treat, such as high blood pressure or diabetes. And as more often as we can to socialize, that you can be feeling depressed around everything that's happening in the world today: COVID, wildfire, storms in the South, or having to, homeschool your children and try and work. And, there's a lot of new pressures, and throw in social media and that people are connected 24/7. There's just a lot of stimulus that is coming at people. And so having discussions around how all this activity might make someone feel, and understanding what it might look like, not just having a depressed mood, but all the other things that we talked about earlier. And I think as schools start to have families start to have those discussions, it will open up a sense of comfort to be able to have those discussions with their healthcare provider. And that's where we need to begin to have, while, as we spoke about before, creating the pipeline, so as more and more people feel comfortable having that discussion, there's someone there who can meet their needs.
Thank you for that. Yeah, mental health conditions are actually quite common in the Latinx community. 1 in 5 Latinos have have a mental health condition. And so I wanted to pass this on to Serena and talk about what kind of resources are available for these kinds of conditions and what kind of systems should be supported and strengthened to make sure access to these resources is plausible.
Yeah, absolutely. So obviously, as we're talking about, there is some stigma, but I think we've come a long way. But in terms of resources, certainly there are more and more, I think, bilingual. I'm obviously particularly familiar or more familiar with psychologists than other professions, but we are seeing more and more bilingual psychologists. As I spoke about before, we're trying to develop that pipeline further, though, to have better resources for our community. Individuals can help can seek help from bilingual providers or try to get help from individuals perhaps who speak Spanish, and then they can help them to get in touch with the proper providers. And some providers also have access to quality translators that can help too. So I'm not sure if in some states that's law, but I know that there is access to translators that can help with that if language is an issue. And individuals can also often access services through the faith community. We've seen that a lot within this community, and that's a very strong community that can often help with resources.
Yeah, and as the professionals, as the experts, right, in this field, what do you guys want viewers to know about this community and mental health and moving forward and strengthening the resources and access to healthcare for these kinds of things? So I'll start with Fred. What do you want viewers to know about mental health in the Latinx community?
Well, let me tag team to something Serena and Laura have said, and they're so spot on to recognize the significance, the importance of how these resources then need to be matched to the people who are seeking help. We understand that 40% of Latino adults don't receive mental health treatment services in the United States. We also recognize that almost 57% of young Latino adults don't receive mental health treatment. And then when it relates to substance abuse, 90% of Latinos over the age don't receive treatment services, 9 out of 10. So what we clearly recognize is we're at a point where if the resources are there, the question is how do we connect people to those resources? And I think there's different levels at which we do that. There's I think the most understated, most misunderstood, and least valued, and that is the significant role that families and individuals play in taking care of themselves. The natural support systems of the Latino community are significantly important to our lives. It represents all the characteristics of the protective factors that help ward and protect us against the conditions that mental health and substance abuse bring upon us. So I would say is besides the families and the natural support systems in our communities, we also have local and then national resources. I'd encourage folks to visit our website at nalba.org. We have a Latino behavioral health worksheet, and that fact sheet helps to identify the types of national resources. And there are some of the organizations associated with this event that have perennially been at the forefront to ensure that that resource information is made available to folks. But we have to keep in mind that there has to be multiple touches, multiple sources, multiple methods of getting information to the Latino community, because in some measure, what we're finding is, and this has been my experience throughout my entire career, is the huge gap and void of information in education that the Latino community wants, needs, and seeks and doesn't receive. And it's very telling about what I will say, certainly in my closing comments about that, because I will want to end with some of the protective factors that are so important to our well-being that we want to continue to reinforce the things that we do well, despite the challenges and the barriers. So I'll just kind of stop there and let my colleagues kind of add to that. So thank you, Kiara.
Thank you. Yeah, and I'll toss this on to Laura next, but I also want to add to the question about, what you want viewers to know, but also what's missing from the conversation. What are we not talking about right now? And your thoughts?
So, in addition to what Fred said, I think, certainly as a physician, I think we need to do a better job in asking the questions. We can't just always put it on the patient to tell us what's going on, but we need to do a better job screening. So the way we ask or take vitals about, your blood pressure and your breathing rate and your temperature, we should also be assessing how's your mood, how have you been feeling, and then doing more to ask some of those tough questions around not only their mood but their physical symptoms that might be manifesting themselves as a sign of other behavioral health issues that are going on. So certainly working with the providers and getting more of the providers to engage. But then, as Fred said, we have to think about all the ways that Latinos touch the delivery system, get information to them, to mainstream the discussion and to open up those dialogues. So school, faith-based organizations, community-based organizations that they're working with, and certainly the healthcare system.
Thank you. And moving on to Serena, what do you want viewers to know? What are we missing from the conversation? What are your thoughts?
Sure. So, yeah, I think we want viewers also to know that there's hope, right? There are mental health treatments out there that are working very well. There, all of us here today and thousands, hundreds, thousands of other professionals that are really trying hard to get to those pipelines and to get to those individuals that need the help, that care. But there is a lot that is working. And there's no shame in asking for help from individuals. And it's important to seek the help that perhaps other people or individuals, for individuals, if those individuals are not able to seek help for themselves. And also, I think the Latino community has many strengths. We need to build on those strengths. There's a strong sense of community support, programs that help one another, as I mentioned before, churches, even through restaurants where there's a strong, solid community feel. And that can help with a lot of mental health as well, just the social aspect of those community efforts. And we also know that immigrants even are actually more resilient than individuals who have been here for generations. I think that's important to remember as well, that our community, not that we're all immigrants, but immigrants are very resilient. And we also just want to underscore the importance of having access to behavioral psychologists, psychiatrists, and all individuals that can help with mental health. And obviously all our organizations here today are here to help and support those who need it. And APA is also happy to translate information as is possible. And we're here to help however we can.
Thank you. And so I'm going to circle back to Fred and ask you the question. What's missing from the conversation? What should we be talking about? What are some nuances that might be missing from this kind of discussion?
I think it's a great question for a couple of reasons. One is because it speaks to something that in my whole career I've observed, and that is how much we have asked for, pled, demanded, and tried to bring to attention the conditions of the Latinos in our country. And there is report after policy after policy, and document after document, and plan after plan. And when you look at it, things have actually worsened, right? So what's missing from the conversation is, who do we turn to for the actionable steps to really make the changes? And that conversation very quickly, but I think that's the point, is we have an opportunity to learn from what we have been able to change and improve in the healthcare delivery system. And I think Congresswoman Grace Napolitano started very early on describing the effort that it takes to persistently bring these issues to the forefront, and it all calls upon leadership. And I would say that it's important for us to speak to these policy issues at a leadership level, both at the community, the state, and the national level, so that there's a concerted effort in the Latino professional community and the Latino communities as well to ensure that we're cultivating the leadership to continue to voice and advocate for the changes that are essential to our well-being, because our health status indicates otherwise. The second would be is really around being able to take, I'd say, into account what the future holds for us. In the year 2050, Latinos will be almost a third of the country's population. What a wonderful opportunity and hope for what our future holds for us, not just for the future leaders that come to us, but how the pipelines today will be prepared to address the stigma, the significant barriers. So when our young children become our replacements, the adults of the future, what we have done is we've instilled in the institutions, in the systems, the changes that we have so suffered from up to this generation. My hope and my dream and my vision is to ensure that NABO plays a role in being able to address those disparities, but bring forward the specific institutional systemic changes that this country is in desperate need of. Because what's happened, the system of care has been designed this way. That's what we have to do, is to reorganize, and restructure the system that actually has created the very barrier challenging today. We have the intellect, the resources, the capacity, and the will. And I would say the conversation really needs to lay out who is behind this change to help bring the wellness of Latinos so that we can help lead in our nation's policy direction in the future.
Powerful note to end on. Thank you for that. So let's move on to some audience questions. And if you haven't sent over your questions, be sure to send them via the Q&A feature on the screen and choose room C. So panelists, get ready. I'll read them off to you. We'll start with the question from Alexis. How can we push mental health in our education system to fill the education gap for adolescents, especially when their families don't believe in mental health? I should direct the question to one of you guys. Let's start with Laura. What are your thoughts on that?
So I think it's what I hinted at earlier. Certainly, having those conversations regularly in the school system, and having, teachers and guidance counselors check in with their students so that, students bring that information home to their families so they can discuss it at home. Guess what we learned in school today? Or for any initiatives around mental health and substance abuse, that they can take that information home. And by the school taking the lead and stimulating that conversation in the school, since kids often talk about what they did at school, we can start to normalize that discussion in the home as well. And by normalizing those discussions, I think more and more will not only access care, but certainly pursuing as a healthcare career long term, to Fred's point about building the pipeline, giving the growing population in the next 30 plus years.
Yeah, this is a great question. I was just reading the other day about how children are having an especially tough time during the coronavirus pandemic and being separated and isolated from their normal school routine. So I also want to ask this to Serena. How do we push mental health in our education system to fill that gap?
Yeah, sure. No, I agree with what Laura's saying. And just to add to it, I think, talking about it at home is a big first step. And I think just normalizing mental health care, however we can, whether it be through families, whether it be through our neighbors, our friends. I think it has improved. I think more people than when I was a kid are more open about their mental health, or any mental health issues they may have. Perhaps it's also my organization, but I do hear a lot more about that now. More people being a little bit more open about it. I think we also see that, in sort of social media and in commercials, even on TV, bullying, which can be tied to mental health. I think, you do see more prevention measures now with teachers and counselors in schools. I know you do see it a lot more discussion. And I think, so I guess what I'm saying is just talking about it more. And as Laura has said, starting with the family. And encouraging people and your friends, family, anybody to seek that help when they need it.
Awesome. Thank you. We'll move on to a question from Rosie. Many immigrant communities do not qualify for government assistance or benefits. How do we see philanthropies filling this gap? Are cash payments an option? So, Fred, do you have any thoughts on this?
Yeah, great question. I would simply say is that a system of care puts emphasis on everyone that's in that system of care. Uh, Philanthropic organizations are very significant to this country, given their long history in providing the resources, particularly which are done in the form of grants in such a way that helps organizations for at least a year's period of time, sometimes 2 or 3 years, to help address community issues. They aren't able to sustain the level of impact that they would certainly like to have. But I think the charitable communities have done a great job of ensuring that resources are made for particular groups who because there's an absence of public assistance, it really hinders their ability to ensure their well-being. So I would say that while I don't think philanthropies are going to fill the entire gap, what they are very committed to doing is leveraging, supporting, seeding, cultivating, and creating the energy for mobilizing on changes. And because of that, there's been efforts across the country, both at the Family Foundation level, the National Foundation level, and other philanthropies who have, in fact, led the charge on many of these issues. So much credit is given to them for really bringing attention to these issues that often sometimes government is very slow addressing or, in fact, isn't addressing. And so we can be assured that the foundation community is leveraging its resources to an optimal level. I think what's important is how we then match and ensure that government then does play a role to helping implement the types of strategies that oftentimes are very innovative. They're grassroots in nature, and particularly as it relates to the immigrant population, the question was very good at asking, how do we ensure the well-being of individuals who then have even less access to resources? That's the underlying issue of health equity, right? As in our country, we the system of care has not done a very effective job of ensuring that all people have access to have the same quality of life that makes all of us healthy individuals. And I think the commitment to do that needs to be done by leveraging every aspect of the system of care, both for resources, for financing, for creativeness, and also for commitment to narrow that health equity gap.
Thank you. Yeah, undocumented immigrants particularly are very vulnerable with lack of access to healthcare, and they didn't receive a stimulus check, many of them. And so I want to pass this off to Laura and ask if you have any advice for particularly vulnerable immigrants at this time.
Sure. So many of the federally qualified health centers and our community health centers offer a sliding scale, meaning you pay based on how much you make and what you can afford to contribute to your health care. And for many, depending on how much they are making, that sliding scale can go all the way to zero. So not having health coverage, although it may limit the delivery system and where you can get access, certainly your community health centers and your federally qualified health centers are charged by the federal government to meet the needs of the community, even if you don't have insurance. And so that's something you can, when you go in for care, certainly work with the clinic staff to address payment issues, which in many cases can be zero. So there are places to access care, even if you are not covered by health insurance, to pay for that care.
Awesome, thank you. And I'll direct this next question to Serena. It's a question from Sydney. I find that mental health professionals are more burnt out now because of everything going on. What can policymakers do to better support these kinds of professionals?
Yeah, no, that's a great question. That's very true, and I know within our organization we constantly receive updates about taking care of ourselves, etc. Um, I think we can advocate as I think it was Sydney that's asking the question. Any advocacy that individuals can do to policymakers to remind them of the even the care that's needed for mental health professionals is important. I think that these issues have come more to the forefront after with COVID. I think APA has certainly been very busy these last 6 months or so. And I think just continuing the advocacy to even your local, state, federal representatives, senators, congressmen, congresswomen, is very important, just to keep emphasizing those issues, keep emphasizing funding for mental health programs is very important through the agencies as well, the federal agencies. So any work there can be very, very helpful. And the more they hear about the need, I think then the more likely there is for representatives and congressional members to provide that needed help.
Thank you. And this next question, I'm going to kind of phrase it for, policymakers and local governments and what they could do for this. Accessing mental health services is prohibitively expensive. What can be done to ensure mental health coverage parity for underserved communities? And so, Fred, do you have any thoughts, if you could speak to policymakers and people in power about that?
Well, I have to again give credit where credit is due. Senator Pete Domenici, our senator from New Mexico, for his entire career, actually led the policy charge on parity in our nation. And much to his credit, months before he left as senator, he said, "We will have mental health parity." And absolutely, that's true. We have behavioral health parity for both addictions and mental health today. And it was really the second reiteration of parity effort that's taken place over the last 30 years. And so I want to just acknowledge that, if I can, for a second. What I have found is that because of that effort to ensure that insurance coverage would allow for equitable treatment of copays, premiums, and other costs to ensure that there's equity across those particular sectors, health and mental health. What is absent today, of course, is the fact that there's not full implementation, there's not full enforcement of the parity laws that are in the books. And so we have to have a broader, a much more comprehensive, significant educational effort to bring to light the lack of that implementation and enforcement, so that we can all start at the same page across the nation, so that every local level of government, every state level of government, as well as federal, understands what accounts for why there hasn't been full implementation and why there has been a limited absence or limited enforcement, if you will. So I think despite the 30 years it took to get to having those laws, we're still at the beginning of trying to ensure that they're fully in place, so that all the health plans in our nation, including Medicaid, is fully implementing the parity laws. And so I think that for me is particularly important, because what we find is the disparate implementations across the states means that the federal law isn't being fully complied with. And that, really is a significant legal advocacy issue for us to face. But my concern is the fact that it has a negative impact on the well-being of people who have a right to be able to have that coverage meeting those particular requirements of law. So I just want to highlight that, because for me, that's a very important thing. Local governments would always say, well, that's not our response, it's up to somebody else. And the federal government say, well, it's up to the states. And, what ends up happening is this misdirection of responsibility means that us have a responsibility to ensure that government as a whole is ensuring the health, safety, and welfare of all of the individuals that are obliged to follow those laws. We need the leadership to have a collective voice to ensure that government is doing its job.
Thank you. And we're running out of time, so we'll just round robin some final thoughts. Frederick, what do you want us to take away from this discussion? What are your final comments?
Well, thank you, Chiara, and to the Institute for the opportunity to be on this great panel with my colleagues Laura and Serena. It's always great to hear, that we're collectively doing this work to support our communities, and particularly the Latino communities. I'll just end very quickly with saying we're at a point where we recognize that the cultural values and beliefs of Latinos really are the underlying principles of a good healthcare system. That is helping, protecting, and providing for the benefit of our own. And that means we have more in common than we have different. I think the protective factors of the Latino community, in fact, speak to that loudly, right? Our belief in providing for our families, our strong work ethics, our resiliency, the value and importance of the family bond, family first, and our cultural and religious traditions, and then ultimately our sense of hope, right? This notion we know that things can get better because oftentimes we've left from conditions where things weren't better, and we sought those opportunities in this country that, in fact, is the reason that people want to be part of an environment where all people can be treated. I'll just end with this. Much credit to the leaders and the heroes and heroines in our country who have led this charge. And there's, of course, several people to always acknowledge, but I do want to say many thanks to Grace Napolitano for always leading that charge. And many of you may remember the former SAMHSA administrator, Nalba Chavez. And then there was the time, believe it or not, when APA, NAMI, and Mental Health America also had Latino national leaders at the very helm of their organizations. We know we can do this together. We know we can do this for the benefit of the Latino community. And I just want to say thank you for this opportunity. And we look forward to being able to continue to help the Latinos for the years to come. Thanks.
Yeah, thank you, Fred, for your expertise today. It was great hearing from you. And Laura, do you have any final comments on what to really take away from this discussion?
Yeah, I would just say, thank you to CHCI for having this topic and having a forum where this issue is getting addressed, and for the other national organizations, state-based organizations, or local organizations that outreach to Latino communities to continue to reinforce the message and have mental health as an agenda topic so that more of these type of discussions can be had to again, normalize the discussion. It's a very stressful time right now. And so being self-aware of how you're feeling and not the typical my mood is down, but some of the other things that we describe, and certainly accessing care wherever you can. And if you're not sure where to go, then starting the conversation in your home and going from there.
Thank you so much, and thank you for attending today with your expertise. And Serena, what do you want us to take away from the discussion? Any final comments?
Sure. Yeah. No, likewise. Thank you for CHCI for having us, for having me. A very important panel and topic. And again, as I mentioned earlier, there is hope. There are a lot of good resources out there. There's a lot that is working. As we discussed today, there is a lot that we still need to overcome. And let's keep working together and continuing to have these conversations, advocacy, and talking to our leaders, members of Congress, our president, and continue accessing the churches, the restaurants, wherever it is that the community is based and that works for individuals is a wonderful way to bond, to secure and to improve everybody's mental health. And again, APA stands here to help and is ready to help in any way that we can, and we very much support the community. So thank you again for the opportunity for the panel today.
Yeah, thank you again to all of our panelists, Serena, Laura, and Fred. And thank you all at home for attending. And if you're out there on social media, be sure to use the hashtag. Thanks again, and stay safe and healthy, and hope to see you in the rest of the conference.